Welcome to Rick's Corner. I have Dr. Marco Guliano back. He's been on before. We've talked about the body, the ailments, the injuries, the joints, the back, the vertebrae, the neck, and all the things that go wrong when you're training and how to fix them so that you have better workouts, right?
That's right.
What is the biggest complaint from your patients that come in as far as part of the body that goes out?
Definitely the lumbar spine.
It is, isn't it? Lower back. And what do you think that's attributed to?
Well, the fifth lumbar is the lowest vertebrae in the spine, and its disc is the lowest disc in the spine. So the research shows that 94% of all compressive forces go straight through that disc,
Okay.
that fifth lumbar disc. And therefore, it's usually the first one to degenerate over time, causing the low back pain.
Let me ask you a question about that, because I've had that go out, and you've adjusted me many times.
Yeah.
In fact, you're the only guy that can adjust me. No one else seems to know how. Over time, when that thing goes out, it affects my legs as well.
It does.
What's the reason for that?
Because that L5-S1 nerve root, Rick, travels and innervates all the tissues down the leg to the foot.
Okay.
And when you have it down to the foot, they call it sciatica, which is actually a misnomer, because it's not the sciatic nerve that's pinched, it's the L5-S1 nerve root on that side.
All right, so you guys have had your back. I've seen you in the gym. You're tweaked. You're walking this way. It's hard to go to the toilet. It's hard to breathe. It's hard to eat. You're moving around like really in pain. It does affect your legs. And I notice even as I've gotten older, and we talk about narrowing of the spine and arthritis and spinal stenosis, someone says, "Oh, your knees bother you." Well, my knees bother me, but not as much as my lower back affecting my legs.
Right.
So what's the relief you can get? What can you do to avoid that?
Definitely good old Gonstead chiropractic care, number one.
Okay.
Number two, a good stretching program. 3, of course, working out, strengthening the core muscles, that is namely the erector spinae muscles of the lumbar spine, and the abdominals, which are antagonistic muscles. They support each other.
Right, I get that. Yeah.
And so you've always built your foundation. You always had a great foundation.
Yeah.
Great physique, because you were strong.
Yeah.
You built your foundation from good compound movements, and that's what I believe. To strengthen that.
All right, so the thing is that I can't squat anymore.
No.
Only because of my right knee. Although squats really built my thighs the way I wanted.
However, you can do other things.
Yeah.
Such as what? Leg press?
Yeah, you do leg press.
Leg curls, leg extensions, hack squat.
I haven't done hacks, but I try to do something that really centers around my quads, and that since I had quad ruptures years ago, and you were there when I did it, they don't function the same as they did. The doctor said I put them right back where they go, but they really don't. So I'm trying to find something that feels like a squat. Now, leg press does not get me exactly where I want to go.
Correct.
It gets me above the knees. It doesn't get the belly of the meat of the quad.
Right.
However, in our gym, there's a slide that you can lay on that's a leg press that you can lay back. You can bring the back part up a little bit, lay it down flat, and put your feet up on a rack, and then it pushes you back and forth.
Exactly.
Well, in my mind, if I close my eyes and hold on the bar, I feel like I'm doing a squat.
Right.
So basically, it is centering the resistance right upon the quad where I want it.
Right, where you want.
Right. And a lot of people don't know that when you do this, and the biggest thing that you do when you want to get that feeling is the concentration on the muscle that you're working.
Correct.
It's very easy just to think about everything else and you don't say, I don't feel it. But that particular thing I do feel. It's hard. I walk away shaking from that thing.
It's damn.
And then I can put 4 plates on each side of the leg press and not even feel it. It's like, this isn't doing anything.
Right.
Yeah.
It's damn hard, and it takes intense mental focus and concentration, but it works unbelievably.
Yeah.
We don't have to squat it out. I'm 55, you're 70. We don't really have to squat, although I do love that squat machine.
Yeah.
Where you put your shoulders under the pads.
Right. There's just something about a squat that does get the thigh.
Yeah.
However, now my next point was, it does compress your vertebrae.
It does compress the vertebrae.
So you're going to have a spinal problem eventually if you squat heavy. Most likely.
You will experience subluxation, pinched nerve, at L5 or L4, or even the sacrum.
Yeah.
That will happen. It happens to me. It happens to you.
It happens to everybody.
Right. So it's just
okay.
One of the prices we have to pay.
Okay. There's another question I have, because a lot of you guys suffer from the same thing we all do, is shoulder problems. Everybody seems to have a bad shoulder injury, can't press, can't do laterals, bench presses are killing the joint. This is very common. I hear it all the time. Well, I told you last night I tripped and I took a tumble on the cement and I hit my shoulder. So now today my shoulder's like really stiff and sore. I went and worked out, and most people sit home and do nothing. I wanted to test myself. Can I do the seated presses? Can I do pull downs? Can I do back? I was able to do everything in a lightweight, but it's sore. After I was done, it kind of swelled up and got more sore. The thing is that in the shoulder, when you have these impingements in what you have in your joint, and they do press on the nerves,
They do.
that also seems to inhibit, for me, bicep and tricep growth. It doesn't grow like it used to. It's not getting the feed to it. Is that true?
It's true because it's not getting the blood supply.
Right.
And the innervation from the nerves.
Okay.
Is diminished.
Right. How do you get around that? I mean, I work my arms hard.
Physical therapy. I love acupuncture.
Yeah.
Chiropractic and massage combined.
Okay.
That's a great combination.
Okay.
We all should do it because we train hard.
Right.
So I really believe in that.
There's a wrestler who I don't want to name. He had a pinched nerve in the shoulder. Very well known guy, and on the left side, and his whole left side is completely atrophied. He can't do anything to bring that muscle back because the nerve is not feeding it. Right.
Correct. The nerve is not innervating properly.
All right.
That tissue.
Okay.
And that will go to the tricep.
Yeah. Went all the way down the arm, whole shoulder, everything. And also can come from the neck, right?
Correct.
So
the C6 spinal nerve innervates the thumb and index.
Right.
C7 innervates the middle finger, half of this finger.
Right.
The C8 goes to here. T1 goes to here.
Okay. Which brings up another point. I had come to you and I said I was diagnosed with carpal tunnel because my hand goes numb. Well, okay, I lost a finger or two. They fell off. And I get numbness on the tips of my fingers. I had my whole hand was numb and it was cramping and burning. Okay. Since you started working on my shoulders and my neck, that went away.
Good.
But it's still at the tips. And I went to a neurologist and I went to other doctors. Well, you need the carpal tunnel surgery where they cut this and open this up. And I started thinking, I'm not sure I need that because the adjustment seems to be from when it starts to go numb and I start moving my shoulder. I'm sure you guys have done this. You start moving your arm around, the circulation comes down, the fingers open up.
That's right.
So that tells me it's not coming from the wrist, it's coming from up in here.
It is.
I don't know how many of you had that, but if you don't have it, you'll get it because it's very common. You know, how do you get carpal tunnel? I don't even use a carpool lane, so I mean, it's impossible. But it's a numbness feeling. It's really weird to pick up something because it's not there.
Yes. Is it pins and needles?
No, yeah. It's kind of like I fell asleep and just waking up.
Right.
Yeah. I mean, I can still train and all that, but it's just, it's an odd feeling. And it has to be coming from up there. Now, some of these things come from, I was told, never do military presses. Been doing them my whole life.
Yeah.
Ken Waller, Rich Piana says, you don't need presses, just do laterals. Joe Barata, who I worked for, had great delts. He just did laterals. So I try not to do them, then I always throw them in, but I think it's impinging the
It definitely is.
Yeah.
And I stopped doing presses, seated presses 3 years ago.
Yeah, don't need them, right?
I don't.
It's mentally hard not to do that.
It is mentally hard.
It's like mentally hard to give up bench presses. You know, we always did bench presses.
Right.
I haven't done them in 5, 6 years.
I haven't done it in 20.
Yeah, there's no need.
No need.
No, I found other things that work better. And I had a guy on here, Stan Editing, who's told me that he doesn't even do benches anymore. He does bands. He's got big pecs.
Yeah.
I don't need them. He says, it hurt my shoulders and just do the other thing.
Yes, they do. I find decline bench now with dumbbells or on the Smith.
Those are great.
Better for me than the flat.
Yeah, they are.
The incline hurts my shoulders as well.
Exactly.
So I stick to that.
Mm-hmm.
We have limitations of matter now since we're older and we've had injuries. So we must train around it, as we always have done.
Right.
Train around injuries, we train around the arthritis.
Well, even
just to keep the joint moving, as we said before.
Yeah.
To nourish the joint.
Even like today, when I had fallen out there, I really got sick to my stomach. My shoulder hurt like mad last night. And the first thing that went to my mind, like all of you guys who train, oh man, how am I going to work out tomorrow? Because it's important to us.
Right.
We're obsessed with it. This is what we do. This makes us feel better. And I got up, my girlfriend says, you going to the gym? I said, yeah, I just put some ice in this full Darren cream on. I'm going to go test it out. That is my only way of testing. Oh, go get an x-ray and go to the doctor. Why? I don't know what they're going to tell me, and I'm certainly not going to have shoulder surgery over this, but I'll go to the gym, and if I can't do anything, then I will go, I'll say, you know what, something's really wrong.
Well, first you come to me.
Well, I come to you.
And we do physics.
I come to you anyway. But I mean, my test is, can I do pulls, can I do pull downs, can I do chest, can I do this? And everything worked. Not as heavy, because I didn't want to go as heavy,
right.
But I could tell that the joint was actually working where it was. It's the muscles around that are swollen. So if that wasn't the case and it wasn't working, then yes, I would go to the doctor. I'd come maybe get x-rays and see what's going on there. But all you guys have suffered from shoulders and lower back. I hear this all the time. The other thing is knees, you know, and that's another issue as well. And it happens to a lot of young people as well who go out for sports in high school. My daughter's 23. She was a gymnast. Her knees are killing her.
Really?
Yeah, she says her knees are popping and making noise and they're killing her.
Send her to me.
Oh, well, she is coming. So it's just your body takes a beating. If you guys are athletes, you want to be a bodybuilder and want to be a wrestler or a powerlifter, whatever, see your chiropractor. Go get adjustments. I really believe it helps.
And I believe also, Rick, that if you combine that chiropractic with good acupuncture, a good massage once in a while.
Right, a massage for sure.
That triune is unbeatable.
Yeah.
If you're an athlete and you want to stay in the gym.
You need someone who's good at acupuncture.
They have to be good. I've been to bad ones.
Yeah.
And I've been to good ones.
I went to one, this old Asian guy who was like 90, and he had a system down, which I think was good, but I also felt more irritated when I came out. I felt relaxed, but the joints hurt.
Oh.
So he would put the cups on and suck them, you know.
Oh, yeah, the cups.
Yeah. I mean, I think he was good.
Cupping. I
don't know. It's I have to try somebody else. The other thing I want to ask you, because you're in the business and you are a bodybuilder and you're a chiropractor, how well do you think growth hormone, IGF-1, and testosterone work to actually rebuild the body from injury, help repair the joints, and help keep you younger?
I think they absolutely do. The evidence is overwhelming.
Yeah.
That growth hormone is the fountain of youth.
Yeah.
And my idols, Dirk Pearson and Sandy Shaw, and their book Life Extension, in 1980 predicted that growth hormone synthetically made in the lab would be all the rage among athletes all over the world. Yeah. They said that in 1980, and they're proven correct.
I remember them very well.
Yeah, on the Merv Griffin show.
Yeah. I went to my orthopedist. I had a Synvest injection in my knee. It's a gel. And I asked him, too, because there's a surgeon who's pretty conservative with what he thinks, except around me, he's real liberal. And I said, what's your feeling on GH? He said, oh, man, that stuff's wonder. It does wonders if you can afford it. He said, it's expensive, but it's expensive, but it works. And I said, okay, I just wanted your opinion because I feel it does, too. And a lot of people don't know, and they do it for anti-aging, whatever. And it seems it's a time factor. It doesn't help in a week or two. It takes months. But it does work in months. It does work.
It works, I think, before months expire. I think in weeks. I've had patients report better sleep.
Oh, yeah, definitely.
Feeling of well-being.
Yeah.
Better skin.
Yeah.
Everything improves.
Yeah.
So, and that's before months go by. That's just a matter of weeks.
Okay, one more thing. What about testosterone replacement?
I think that every man over 40 should have his blood work done. Yeah. With a complete testosterone, free testosterone, total testosterone. Right. Tested every 6 months. Yeah. Because if you're low in testosterone, that is bad.
It's going to affect everything.
Yes, it does. It affects not only libido, it affects general energy, feeling of well-being. Yeah. It affects sleep. Yeah. Because it is a major hormone.
Yeah, and it affects your drive and your feeling of getting up and going and doing stuff. Right. Yeah, big time.
And so I have sent many patients to my MD, who's an anti-aging guy as well. And these are guys who got tested and found out they had the testosterone of a little girl. So I said, look, you have to go see my guy. Yeah. Go see him. He will take care of you.
And they feel better.
Of course. Yeah. Immediately with that.
There's no question about it.
Within 2 weeks.
Yeah. Oh, within a few days. Yeah. Well, geez, that answers all my questions. But it makes a lot of point. I mean, you're going to have to do these things to be better at what you do. I wanted to get his views on chiropractic and joints and muscle tears and in rehab and anti-aging and growth hormones and testosterone because everybody has a different point of view. However, I'm finding lately that everybody that comes on the show has the same point of view. We're all on a positive note with this thing, and I totally believe it works. Taking that fall last night, any guy 70 years old like me would be home, sitting on the couch or in the hospital, sitting there. I was back in the gym the next morning.
That's the average guy.
The average guy.
You're not the average guy.
No, but I
You're an animal.
I don't want to buy into that sitting on the couch thing.
You're Superman.
I'm trying very hard. Where can we reach you on the internet?
drgchiro.com. Okay. And I have 2 locations, one in Burbank. Right. That's 111 North Victory Boulevard, Burbank, California. Phone number 818-558-4030. And my other locations where I live in Playa del Rey, in the Marina del Rey area. Yeah. That area code's 424-625-9894.
That's by the ocean where all the rich people live. It's a nice area, trust me. Well, thank you for being here.
Thanks.
It's always a pleasure. We get a lot of world's problems solved today on Rick's Corner. But stay tuned for more shows. I have a big array of guests coming on, and you're going to enjoy every minute of it. And thanks for being a fan. And don't forget, I have a new line of t-shirts coming out on Rick Grayson Originals The old Gold Gym logo with my signature, along with other Muscle Beach shirts, the Golden Hour Bodybuilding, is going to be released within the next 10 days at rickgraysonrituals.com. You can order direct and have it shipped to you in a couple of days. There are no shirts like this shirt. It's my only design by me with my signature, with a hand tag that has my name on it. So remember that, rickgraysonrituals.com. It'll be live, I think, by the end of next week. See you next time.
Bye-bye.
It's rickdrasin.com. He is the equalizer, baby. See you next time.